Hi, I'm Dr. Barbara Jo McGarry. I'm the Program Director of the Rutgers Robert Wood Johnson Family Medicine Residency Program. Our program started over 40 years ago in 1980, and we have graduated over 230 family physicians. Having the resources of an academic medical center, we can help you become the family physician you dream of becoming.
Our program enjoys a wide variety of practice training opportunities for our residents because of our location and our relationship with our university. But our main ambulatory practice site, Family Medicine at Monument Square, is quite unique for a university program. It's not attached to the university, it doesn't run like a clinic, it runs like a true private practice. And at that site, our residents learn to practice full scope family medicine. We're the largest primary care site in our whole organization. We see over 31,000 patient visits a year.
Strengths of this program are the people, from the faculty to the support staff. Second strength of this program has to do with this holistic approach to family health.
We're really proud of the behavioral health services and the program that we have here in our residency. We've had fully integrated evidence-based behavioral health services in our practice for more than 10 years now. It allows us to identify and to treat all the things that we see in primary care: anxiety, depression, insomnia, health behavior change, all the things that we see every day in the clinic. And it allows the residents to be more effective, to work with people who have different skill sets and can coordinate really excellent care within the practice.
We have tremendous diversity in our patient population, not just culturally, racially, and language, but even in payer mix. So our residents learn real life practice management that they can take out into practice no matter where they practice. And we perform procedures, pretty much every procedure that doesn't require general anesthesia.
That's going to insert all the numbing medication and the steroids within that knee joint, and then when you move around, it's going to distribute out for the rest of the knee.
So one of the areas of diversity that the program's addressing that I'm most excited about is we're starting a new program for our LGBTQ community. We're going to be the comprehensive primary care site for the proud Gender Center of New Jersey. This has always been an interest of mine, caring for this population, especially learning more about trans health care. And I'm just really excited to be part of implementing a new program to help serve this population in the community.
So the first thing I want to talk to you about is our inpatient floors. So while you spend time rotating through the hospital and taking care of our patients on the inpatient floors, you're going to get the opportunity to learn from not just the family medicine faculty, but also our hospitalists. And the unique thing about that is that the hospitalists, a lot of them are actually family medicine trained, and some of them graduated from our very own residency program. So I think that makes a pretty unique learning opportunity.
So at Rutgers, we are an opposed program. That means we have a lot of other specialties in the hospital besides family medicine. So I get a concern from a lot of medical students if we have to fight for our patients and if there's enough patients to see. So I don't find that to be a problem at our institution because we get to see our own patient panel at Family Medicine Monument Square, and we have continuity with those patients. So whenever they come in through the emergency room, we are the ones to see them and take care of them and admit them. So we're never fighting with internal medicine or pediatrics over care of the patient. They are labeled as our patient, and we take care of them the whole time that they're in the hospital.
So I know many of you, when you are committed to family medicine, you also have passion for the community health, and you certainly can get a lot of opportunity here. You can work with the community-based organizations in Greater New Brunswick area, explore the resources helpful for your patients.
Fellowship tracks offered include academic medicine, addiction medicine, community health, dermatology, geriatrics, global health, hospital medicine, integrative medicine, lifestyle and preventive medicine, LGBTQ care, maternal child health, primary care research, reproductive health, and sports medicine.
I've always been interested in dermatology, and our faculty worked with our Rutgers colleagues in dermatology to create a longitudinal elective experience which would give me more training in that field.
Going into family medicine, I knew I wanted to do a sports medicine fellowship, and this program has a fellowship attached to it, and it additionally offers you a track in which you systematically attend your specialty clinic once a month instead of an office session.
We serve as team physicians for the Rutgers University sports teams, taking care of their elite level athletes. You're going to have the opportunity to work with us in the office to take care of these students' medical and sports medicine conditions. Through all of this, you're going to get an amazing experience and have confidence treating all sports medicine patients.
Our residents have dedicated didactic time on Friday afternoons, and each week it is something new and different. Whether it be a presentation, a board review, a workshop, or a simulation session, it keeps our residents engaged. These presentations come from community leaders, specialty experts, and our own faculty. Just alone and in the past year, we have done Nexplanon and IUD workshops, point-of-care ultrasounds, laceration repair, and musculoskeletal cadaver workshops. An exciting new addition this year was our social justice curriculum, which allows us to learn about health disparities and systemic racism.
What do we look for in a student applicant for a residency position in our program? What we look for goes beyond solid academics. We look for someone who is interested in the community, who's truly interested in the patient sitting in front of them, providing comprehensive and compassionate care. We look for residents who are interested in learning, evidence-based medicine, interested in teaching. We have medical students and other residents, and teaching is our lifeblood here. We look for residents who are interested in helping the community, not just medically, but financially, looking at social determinants of health, looking at costs of medications, costs of tests. This is really important to us. And lastly, we look for residents who are fun, who are diverse. This makes our experience in our program well-rounded and lots of fun.
Our faculty had the difficult task of having to basically come up with COVID teams overnight. Our chief residents did a phenomenal job of, making sure that it was a very balanced schedule where we had time to not only physically recover from, the impact of being on the COVID floors, but also mentally recover. So before all of this, I felt pretty confident that I was at a program that valued wellness and resident well-being. But after seeing the actions that were taken during the pandemic, I know that I'm at a program that really values wellness.
So on your downtime, the good thing about our program is that we're centrally located. We're about 45-minute train from New York or Philadelphia, and we're a 30-minute drive from the Jersey Shore. So if you're into the city life or like the beach, there's fun things to do. I'm a foodie, so I love the trendy, diverse restaurants and bars that surround. And if you're into stage performances or musicals, there are 2 performing arts theaters very close by.
So while we do hang out after Friday didactics, that's not the only time we hang out. We also get together outside of work, and we've done Topgolf, dinner, movie nights at people's places, and a bunch of other things. So we're not just work friends, we're real friends.
In our program, our motto is, we want you to become the family physician you envision. And indeed, we have accomplished that. Our residents have gone on to do many different things. The great majority still go on and do family medicine, outpatient and inpatient medicine. Many, though, have gone into subspecialty areas, be it hospitalist medicine, fellowship track in specialized women's health procedures, geriatrics, addiction medicine, sports medicine is very popular. We also have residents that have gone on to federally qualified healthcare centers, working in community settings, becoming medical directors of their practices. We have a big interest in residents pursuing academic medicine, becoming program directors. We have a big interest in leadership. Many of our residents have gone on to be active both in state and national organizations in family medicine leadership.
So honestly, I don't think I could be more satisfied. When I was applying, they really emphasized being able to tailor your training to your specific interest. And that has certainly been the case for me.
So if I were in your shoes and I had to go through this process again and choose a residency, I would pick this one every single time.